The Ohio River may be nowhere near flood stage at the southern tip of the state, but make no mistake, there is a deadly flood of opiates, opium-based prescription pills that started here near Portsmouth in Scioto County, the likes of which the state and the nation have never seen. And experts say this opiate problem didn't begin on the streets, but in some doctors' offices.
That's where this particular epidemic started. It started between the pharmaceutical companies and primary care physicians.
So how many opiate pills do doctors prescribe for patients? According to state pharmacy records, in 1997, doctors prescribed 7 pills per capita in Ohio. That is, there were enough pills prescribed to give each person in the state 7 of them. By 2010, that number was 67 pills per capita, almost 10 times higher.
The number of deaths, it was proportionate to the number of pills being prescribed in this area.
I didn't care, I was ready to die.
Recovering addicts like Terry Ballingy say an addiction to prescription opiate pills can be more powerful than being hooked on their illegal cousin, heroin, and more debilitating.
I can understand how people OD and die because I was right there.
And recovering addicts say the opiate pill problem is more pervasive than most of us understand.
It's not just the people you see laying on the streets. It's the judges' sons and the cops' sons, and it's everybody.
How big is the problem in Portsmouth? Stepping Stones has 8 houses for residential treatment of women drug addicts just in this neighborhood alone. There are 8 more throughout what is a pretty small city for men. And 1 in 10 babies born in this area are born addicted to opium.
I relapsed while I was pregnant with her, and I used until 3 weeks ago.
Randy Carr is grateful that her 8-month-old daughter Braylee hasn't yet shown any effects from her mom's opium addiction.
You want my kisses?
And prays that the baby she's now carrying will also be born healthy because Randy is now in treatment.
This is affecting my kids. It's not just about me anymore. It's time to quit being selfish.
As a mother, I'm very concerned. I feel guilty. I'm ashamed.
But Armanda Lawson is proud that she's now embraced treatment halfway through her pregnancy, but knows her unborn daughter's future is unknown.
I'm very concerned about my baby's well-being, its mentality, if it's going to have learning disabilities or any physical impairments.
The pill explosion began near here in southern Ohio after unscrupulous doctors set up so-called pill mills where people paid cash for opium-based prescriptions. A new state law closed the mills, but the addiction problem remains high in the area, as do the number of opium-based pills prescribed.
We had 9.7 million doses written in 2010, and now we have with pill mills. And now here we are in 2012 with no pill mills, and we're still writing over 7 million.
Portsmouth in southern Ohio may be ground zero of the opium epidemic, but like a cancer, it has spread across the state and across the nation. And greater Cleveland has not been spared.
All rise, please.
Inside the Justice Center every week, Judge David Mattia presides over a drug court. This is a typical day.
Raise your hand if you're primarily opiate dependent, opiate or heroin. Raise your hand.
19 hands go up. That's half the defendants who are here on this day.
I've been a judge for 14 years, and 10 years ago, 5 years ago really, I hardly saw any kind of heroin or opiate type cases.
But as the opiate cases have risen, so have deaths from unintentional drug overdoses. In 1999, 327 people died from overdoses in the state. In 2010, that number was 1,544, an alarming 372% rise. Drug overdoses have now passed auto accidents as the state's #1 accidental killer.
Feeling bad? You call your sponsor.
Yeah.
You don't call your dealer.
In open court, defendants are asked how they are doing with treatment programs. Behind the scenes, though, where cameras are rarely allowed,
I hope to have her in jail tomorrow.
the conversations are incredibly blunt. Getting defendants who've gone back to drugs back into jail is done less to punish them and more to try and save their lives.
She did 30 days for falsifying.
After she got out of jail, before she...
Yeah.
She's going to be dead.
This is what makes drug court different. The prosecutor and the defense attorney sit side by side with caseworkers, the probation department, and the judge, everyone working together. The defendants have already pled guilty, and the team is trying to get them through a year-long treatment program where they normally avoid jail if they stay sober.
You can't make a horse drink, but you can make him thirsty. So each one of us, anybody involved in drug court,
is trying to make that client thirsty for a better life.
The explosion of opiate abuse in Ohio has only made the job more difficult.
We're in the middle of an opiate dependency epidemic.
An epidemic that continues to flow and continues to kill. One person now dies from a drug overdose in Ohio every 6 hours. Bill Shield, Fox 8 IT. You start out on a painkiller prescribed by a doctor, and you wind up a drug addict.
Okay, everybody, please be seated.
It's a story Judge David Mattia hears just about every week in Cuyahoga County Drug Court. On this day, 19 of the 38 defendants raise their hands when asked if they are addicted to an opium-based drug, like heroin. But that's only half the story.
And could you raise your hand if your dependency started by treating for a medical condition?
10 people raised their hands, including Crystal Manlett, who is a nurse.
I probably won't be able to get back into the medical field until after I graduate and the felony is expunged from my record.
Crystal's addiction started after her spine was crushed in a horrible car accident, leaving her in incredible pain.
They had me taking Percocets, then they put me on OxyContin, and I slowly progressed, getting caught on the opiates through them prescribing me OxyContin.
Crystal is here on a credit card fraud charge related to trying to get opiates, and no one is more surprised than Crystal herself.
I'm a registered nurse, you know, I help people. I'm a caregiver, you know, I never thought of using drugs.
But Crystal says she felt trapped by the pain.
When I had my accident, I didn't want to use the drugs, but I couldn't manage without it.
Judge David Mattia says he sees a lot of people here in drug court caught in the same catch-22. People whose doctors have tried to help them with pain, but people who've been prescribed so much of an opiate, an opium-based drug like OxyContin, that they've become addicted to it.
It creates an undercurrent effect of, maybe overprescribing.
According to the State Pharmacy Board, doctors prescribed 7 opiate pills per capita in Ohio in 1997. That is, enough to give every person in the state 7 pills. In 2010, that number had exploded to 67 pills.
It's almost a tenfold increase, and it just, corresponds to the rise in opiate dependency that we've seen in the courts.
The probation officers and I chuckle a little bit. We get a little excited when we just get, a possession of crack rock, because it doesn't happen anymore. It's all opiates.
Part of the drug treatment program,
Life's a struggle, period,
is to attend therapy sessions with others trying to beat addiction, and sometimes a whole lot more.
So Wednesday, I meet a new cancer doctor, and then I'll either have to have surgery, chemo, or radiation.
Sandra Bentley now faces an uncertain future.
I'm scared about tomorrow, and tomorrow's almost here. All right?
At the same time, she's trying to stay sober.
So I think I'm doing really good. Yeah. And it's just a whole lot. Of course.
You're doing fabulous, because anybody under that situation would probably go back to using.
Part of therapy is to help people understand that others are coping with life's struggles without resorting to drugs.
So whether it's a death in the family, cancer, or even just your day-to-day stress, that's all part of recovery.
But more and more people now need to recover from addictions that started in their doctor's offices.
If you just think, well, my doctor's giving this to me, it must be safe, it must be good, then that's where you can get into a sticky situation.
Which is where Crystal found herself before drug court.
If I didn't have this chance with drug court, I would be dead right now. The drug court program's a lot of work, it's tough, but life's tough.
Especially if you tried to beat an addiction that started when you were simply following doctor's orders. Bill Shield, Fox 8 IT. Believe it or not, you are watching 15-year-old Alex Ford treat his pain. Pain that was so bad 3 months ago that he was being pushed around in a wheelchair. Then Alex came here to the Pediatric Pain Rehabilitation Program run by the Cleveland Clinic, the only accredited pain program for kids in the world. And for Alex, everything changed.
You can do something about your pain without having to take pills, or your pills aren't your only weapon against the pain.
Alex is fighting a painful neurological disorder, and think about this. As Ohio battles an opium-based epidemic where accidental overdoses now kill more people than car accidents, Alex can't battle his pain with any opiate because of bad side effects. And yet his pain is still remarkably under control.
He's gotten his life back without the need for anything like a narcotic or an opiate.
In a moment, we'll get into some detail about just how Alex is beating his pain, but finding ways for doctors to treat pain without risking addicting their patients to opiates is more and more a matter of life and death in Ohio.
In 1999, there was roughly 1 overdose death a day in Ohio. In 2010, that increased to about 4 overdoses a day. And that's
about 1,000 healthcare officials from all over Ohio converged on Columbus recently searching for answers. According to state pharmacy records, doctors now prescribe almost 10 times as many opiates as they did just 15 years ago. While the state has moved aggressively against so-called pill mills, where some physicians prescribe pain medicine for cash, the pharmacy board still raids some doctors' offices, as it did just a few weeks ago here in Cleveland Heights. This may help, but only so much.
If you just stop a given drug, people with an addiction will just switch to another drug. We're already beginning to see some folks move from prescription drugs to heroin.
That trend has hit Cuyahoga County with a vengeance. Look at the number of heroin deaths in the 5 years ending in 2011. 235 deaths in Cleveland, 25 more just in Lakewood, 20 more in Parma, and nearly 150 more in the western, southern, and eastern suburbs. Bill Denahan, the head of the County Drug, Alcohol, and Mental Health Board, says simply,
"It is an epidemic of major proportions."
The state of Ohio has moved aggressively, passing a law to put the pill mills out of business and recently issuing guidelines to emergency rooms when it comes to prescribing opiates. Still, every expert we spoke to agrees much more needs to be done.
I think the docs have a big responsibility in this.
That's why University Hospital says it has developed brand new guidelines for its doctors on how they should prescribe narcotics for patients, how they should follow up with those patients, and importantly, how they can look for alternatives to prescribing opiates. But even with all that, UH's chief medical officer says doctors also face their own catch-22.
We want patients' pain to be well controlled. We don't want our patients out there suffering pain. On the other hand, we don't want to get them hooked, if you will. So that's why we think our guidelines are at least a starting point.
Another starting point is to get unused opiates out of medicine cabinets and disposed of properly where they won't hurt the environment. Operation Medicine Cabinet recently took in close to 5 tons of prescription drugs in just Northeast Ohio on just one collection day. And many police departments, such as here in Lakewood, now have drop boxes where unused pill bottles can be disposed of safely.
The idea is to get these old prescription drugs out of the homes and properly disposed of where they can't be either stolen or taken by young people and abused.
One young person who won't be looking to opiates for answers is Alex Ford. The head of the program Alex is in says they start by changing how people view pain.
What I like to tell kids and families is to think about pain as pain, but know that suffering is optional.
So, for example, sometimes patients can't sleep well because of their pain, but if they can exercise through some pain, it can help them be tired enough to sleep better, which can in turn help them feel better.
It was very hard for us to imagine that the clinic's philosophy actually works in practice, that you have to get your life back before you can deal with your pain.
It's also some mind over matter. Alex says he's been taught that life is like driving a bus.
Sometimes for some people a pain passenger will come on and you can either pull over your bus and say, I won't keep going until this pain passenger leaves, or you can say that I will deal with the pain passenger but I'll continue driving.
I don't use the word miracle very often, as I've said to Dr. Benez, but for us this feels like a miracle.
It's one step at a time for both Alex and a state that's racing against a prescription epidemic that now kills over 1,500 people every year. Bill Scheel, Fox 8 IT.